Hello and welcome to today's New England PTTC webinar, Introduction to Evaluation for Substance Misuse Prevention Professionals. Before we begin, I'd like to share a few small pieces of information. Today's webinar is sponsored through the New England Prevention Technology Transfer Center, or PTTC, which is a program funded through the Substance Abuse and Mental Health Services Administration through a cooperative agreement. The New England Prevention Technology Transfer Center provides training and technical assistance services to prevention professionals and stakeholders in the 6 New England states. The New England PTTC is one of 10 regional centers providing these services across the country. More information about the New England PTTC and our other resources are available on our website, pttcnetwork.org/New England. If you're joining us today from outside New England, you can find your regional center located on this map, as well as our 2 national focus area centers in the National Coordinating Office. The use of affirming language inspires hope. Language matters, words have power, people first. The PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. We invite you to reflect on these thoughts and incorporate this into your work as well. Now, without further ado, I'd like to introduce today's webinar presenters, Megan Hawks and Kim Magoon, both of Public Consulting Group.
Entities. I also serve as an evaluator, consultant, and manager for projects that promote population level health and mental health, as well as substance use prevention, treatment, and recovery, as well as other data projects promoting cross-sector data sharing, analysis, and dashboard creation. I'm joined today by my colleague, Kim Magoon, who will also introduce herself.
Good afternoon. My name is Kim Magoon. I work for Public Consulting Group as an evaluation analyst as well. And I'm a project lead for our evaluation work with the New England PTDC. But I work in prevention evaluation and child welfare evaluation in various states across the country. So thank you for having us today.
Great, thanks, Kim. And we'll breeze by these slides as we've already discussed them. And so this is a 4-part series on evaluation for substance use prevention professionals. Each session will focus on a different aspect of evaluation and will center around providing knowledge and skills to help prevention professionals better understand this important element of our work. Today's session will provide an introduction to evaluation, which we will go into the objectives in just a minute. In February, we're going to discuss designing your evaluation, which will provide greater detail into the different types of evaluation and designing your evaluation questions. And then in March, we're going to focus on conducting the evaluation, which will touch on implementation, data collection, and analysis. And then we'll conclude our series in June with using evaluation to make data-driven decisions focused on your storytelling for your evaluation, using evaluation results and dissemination platforms for a variety of your stakeholders. It is with this foundation that we're hoping that participants will be empowered to make decisions about conducting and implementing evaluations for their substance use prevention programs. And so our agenda today will first introduce Public Consulting Group. We'll review the objectives. We'll discuss why evaluation matters. We'll discuss the strategic prevention framework and evaluation cycle. We will learn more about developing a theory of change and logic models. And then we'll be doing a brief group activity for about 10 minutes, and then we'll have you come back and share. At that point, you can raise your hand to discuss your results, and then we'll finish with some questions. So more about Public Consulting Group. We're a national management consulting and evaluation firm that has served the public health and human sectors for more than 30 years. We have 4 practice areas: human services, health, technology consulting, and education. Our headquarters is in Boston, and we were spread out around 61 offices, all currently working from all of the states at home now. And our primary mission is really to assist public agencies to improve practices by providing solutions that matter. And our evaluation team is centered within this, and so we conduct process and outcome also impact evaluations through systematic data collection and analysis. We evaluate the broad range of health and human service projects and programs across the continuum of care, from promising and emerging prevention and treatment programs to community-based, school-based, and residential setting programs. PCG also utilizes the action-based research model, which requires the evaluator to be actively engaged in the implementation process by providing technical assistance and guidance on an ongoing basis. So during this session, participants will define evaluation, identify the reasons why program evaluation is important, explore common concerns about evaluation, learn when and how to decide to hire an expert for evaluation, and then learn how to build the basis of an evaluation, which our foundation is the theory of change and logic model. And we want these to both be culturally responsive as well as setting up sustainable continuous quality improvement. So what is evaluation? Evaluation is a systematic process to determine merit, worth, value, or significance, as said by the American Evaluation Association. While there are many types of evaluation, we will primarily be discussing program evaluation during our series. Projects and programs of all kinds aspire to make the world a better place. Program evaluators gather and analyze data about what programs are doing and accomplishing to answer questions about its effectiveness, impact, outcomes, cost, or efficiency. These questions are often to the tune of what is working, what's not working, what could work better, what is the value out of this program, how can we tell our story to the different stakeholders, participants, and funders alike. And so this is just a word cloud, which is something we often use to disseminate some of our results. And so evaluation, we understand, can be often overwhelming with an abundance of various jargons, evaluation theories, and methods. And so we're hoping that this understanding of the basics of evaluation will allow you to make sounder decisions about evaluation methods, approaches, and the various partners you choose to engage in your evaluation approaches. So evaluations provide an opportunity for a program overall to be considered. A well-developed theory of change and an accompanying logic model provide an outline that will help to develop measures of success that are documented through the program's development and impact over time. These measures, in turn, will need to be focused with appropriate key evaluation questions that are driven by funders, project participants, and other key stakeholders. We'll take a deeper dive into the logic models momentarily. And so this is the evaluation criteria. Focus on relevance, effectiveness, efficiency, impact, and sustainability. And this was developed by the Development of Assistance Committee on Development Evaluation. And so some of the key questions to consider as a very baseline for your evaluation are, is the program doing the right thing? Is the program achieving its objectives? How well will the resources be used? And what difference does the program make, as well as will the benefits last? Other evaluation questions you might want to consider in a more complex program should address contextual factors such as a global pandemic. Sometimes you can plan for them, oftentimes you cannot. Reasons for adaptations of your program. This is touched on in the strategic prevention framework, as well as interrelationships among stakeholders or different systems that are going to impact the project's success, sustainability, and transferability, which often will shine through during process evaluation, which we'll go over in much more detail during our next session. Oftentimes there's confusion between what is research compared to what is evaluation. And this is exponentially important when you are going in front of an institutional review board. And so one of our founding fathers of evaluation, Patton, has said research seeks to improve, whereas evaluation seeks to improve. And so with that mindset, research really is more about creating the evidence, whereas evaluation is assessing effectiveness of that evidence. The goals of research are to contribute to the knowledge base, whereas the goals of evaluation are to improve the programs. Research questions are really derived from the research, whereas evaluation questions are derived from the programs. And research is conducted in a more controlled setting, whereas evaluations are conducted in the real world dynamic setting. And so we often hear many concerns that arise when people think about evaluation. So evaluation will be too complicated. While some evaluations are complex, evaluation designs can be simple and straightforward. An independent evaluator or consultant can help develop an evaluation design that is appropriate for a program, given the program's service model, the evaluation questions a program wishes to address, and the program's resources for conducting the evaluation. Or evaluation will be an additional burden to staff. In order to minimize the potential burden on program staff, evaluation activities must be incorporated into ongoing program management activities. We'll talk about this more in a minute as well. Also, when feasible and appropriate, evaluation data can also be collected from an evaluator, taking a lot of the burden off the staff. And so evaluation is just another way to put staff under a microscope, but in fact, a program evaluation can improve staff's frontline practice with participants. Improving how frontline staff members deliver services to children and youth will increase the likelihood that a program will achieve its positive outcomes with program participants. Conducting an evaluation of a program can also allow the program manager to systematically assess the staff members are succeeding or where they may need support or training. An evaluation can also provide staff with opportunities to discuss the challenges they face and offer the potential solutions. Other common concerns. How do you know the evaluation is reaching the right people? Evaluation results will help showcase through the outcome measurement if the intended target population was reached, or also if health disparities remain or if they were amplified. It is also important to include a broad range of stakeholders throughout the evaluation cycle. Evaluation will divert resources away from the program. While it is true that evaluation will take some upfront resources, typically about 10% to 20% of the overall program budget is needed to conduct a thorough process and outcome evaluation, what a program can learn from the evaluation can help streamline its resources to focus on what works for program participants and improve outcomes. It really should be seen as an investment. The expense of an evaluation is also very relative. The costs depend on the questions being asked and the level of certainty desired for answering those questions. A simple low-cost evaluation can deliver some valuable results. However, it's best to invest in the most comprehensive evaluation wherever possible. And also, what if evaluation results show that your program isn't working or potentially also produces negative effects? So finding out what does not work is as important as finding out what does work. So knowing what works helps program managers to focus resources on essential components of the program model that benefit participants. Knowing what doesn't work allows the program managers to improve and strengthen their service delivery models. Not knowing what is working may waste valuable time, money, and resources. So this often generates those opportunities for improvement, and having regular ongoing evaluations enable programs to make mid-course corrections and improvements. But why should you evaluate? Strong evaluation data are often a powerful tool for many reasons. They often provide a different perspective from the program team about the need or problem. Also, engaging evaluators as part of the program development or grant application is critical to ensuring that the plan is thoroughly thought out and also integrated into the programmatic design. This also establishes checkpoints and continuous quality improvement, which is something that funders look for. So other reasons to evaluate: showing the program benefits to the community, reporting to the funders, tracking outcomes, tracking the changes over time, reviewing cost efficiency, building a better program, identifying gaps, as well as health disparities. But how do you know if this is just all too much, too complicated, or whether you need to hire an evaluator, professional evaluator or not? And really, this question only you can answer for your program. But there are several factors to think about and weigh in on. For example, internal evaluators, they have a strong understanding of the problem being evaluated. They also have access to the data and the stakeholders. It is also oftentimes less expensive. And however, they commonly often lack the expertise that an external evaluator can provide. There's also potential conflict and bias that may arise, as if they're part of the implementation team, they may feel the need to really report more on those positive aspects of the program rather than having an unbiased objective view. And then funders may also believe that the internal evaluators lack objectivity for those reasons I just explained. And so we're slightly biased in this because we are external evaluators. Some of these external evaluation pros are having the technical expertise and experience that you may not find in your local organization. Because they're not members of the agency, they bring that more objective approach, often as free as they can be from bias, and often generating a new perspective. And they're not affected by the internal pressures from organizations or stakeholders that have really a more invested interest in the evaluation's outcomes. And this also lends to reporting as well. As an external evaluator, we're able to report our recommendations, and they may not be the same views as the agency. And so they can say just that they're, the views of the external evaluator to really approach some of those harder issues. Many funders also require external evaluators. SAMHSA often does require external evaluators for a lot of their programs, as well as HRSA. But they may take a lot more time to build and establish relationships with the stakeholders, and also often costs a little bit more money than you're going to see for an internal evaluation. And with that, I will hand it over to Kim Magoon to discuss evaluation for substance use prevention professionals.
Okay, I think I am now sharing my screen. So what does evaluation look like? Because that's why we're here, right? We want to get into the nitty-gritty of this stuff. So to evaluate whether your policy or program is successful, you need a clear idea of what you're trying to achieve, and an assessment of whether the program is meeting those goals that you identified. And to do this, SAMHSA promotes the use of the SPIF model. This should be familiar to many folks on the call. So SAMHSA uses the SPIF model to develop strategies predicted to forestall substance misuse. So the SPIF approach embraces and promotes data-driven decision-making and outcomes-based programming. So the SPIF model was really created to address the factors that cause or have an impact on substance use that can be mitigated with intervention strategies. And SPIF is really intended to build state and local capacity to decrease substance use and misuse using the 5 modalities pursued at both the state and local levels. So step 1 is conducting that community needs assessment. Step 2 is actually mobilizing and building capacity. Step 3, you're developing that comprehensive strategic plan. 4 is implementing the evidence-based prevention programs. And then 5 is really that process, monitoring process and evaluation of the effectiveness of your program. Ideally, you can document what your community or need look like before you begin the program. Sometimes that's not always able to be done, but the evaluation is part of this ongoing cycle of program planning, implementation, and improvement. These are some examples of some other frameworks. So this one on the left-hand side of your screen is from the United Nations Office of Drug Control. And we're going to look at that one more closely in a moment. That top one is from an Australian professor, William Trocham, and then that bottom right is from the CDC evaluation framework. But they all kind of say the same thing, right? There's a certain set of steps that you have to go through each time you do an evaluation to continually inform that continuous improvement process. So this is that UNODC model, the United Nations Office of Drug Control, that further outlines that evaluation cycle. So ideally, the evaluation is developed before the program is designed and implemented and then based on the goals and objectives of the program. But often in practice, this isn't really how things work. So there's some re-engineering required. However, every evaluation follows this same layout. You outline the goals of the program or the policy, you document the program and objectives, you develop your theory of change and logic model, determine the type of evaluation you need, and then you actually develop the plan with your evaluation questions, with your methods, sources, and collection protocols. And you actually do it and conduct your evaluation, and then you have to use the results, right? Because it's all, you don't want this all for naught. So let's start at the beginning. Let's assume you already know what the goals of your program or your policy are, and you already know what the how the program or the policy is supposed to work. How do you build a theory of change and logic model that support this as a basis for your evaluation? And this is what we're really going to get into today. So a theory of change describes why a desired change is expected to happen. It's what really connects the intervention activities with the expected outcomes. So essentially, it kind of acts like a compass to say, this is the direction I want the program to go, or I think that the program is going. While that logic model is really the map for how the evaluation of the program can measure to see if that's true. So the American Evaluation Society states that to be useful, a theory of change needs to be plausible, doable, testable, and meaningful. So let's take a look at this. And we'll see how theories of change are really used to link these activities, outputs, outcomes, and anticipated impact. So let's take a look at an example here. So, like I said, the theory of change is really an explanation of how the use of the inputs and activities are going to produce those outputs and outcomes, and sets the stage for the impact. So this is kind of a lighthearted example, right? From monitoring evaluation news. It's definitely one way to think about a theory of change. So the songwriter, or in this case, the evaluator, makes some assumptions about Jude's behavior. Says, hey Jude, don't make it bad. Don't be afraid, don't let me down. Then there's a couple of activities that are suggested, like remember to bring her into your heart, let her under your skin. And if those activities are done, then the songwriter or the evaluators predict an outcome. They say that if you do these things, then it will make it better. And in a long-term impact of doing these things, this just gets better and better and better and better and better. So what does this look like in practice? Like I said, this is a silly example, but let's put it into some context that probably sounds a little more familiar. So here's an example of a more simplistic theory of change for a youth marijuana use prevention program. And you'll note this follows the same if-then methodology. So first, I have my assumptions. This is a fictitious program, by the way. This doesn't actually exist, but sounds pretty plausible. So I have my assumptions. I observed that marijuana use among high school youth has steadily increased over the last decade in Armstrong County. And I can empirically see that. I could see the rise in something like the National Survey on Drug Use and Health from SAMHSA, the NISDA. Maybe I was looking at marijuana-related school suspensions. Maybe I was looking at restorative justice programs, see how many people have come through for that. But I could see that there was a rise. And I think it's because the changing marijuana legislation has increased access to marijuana and decreased the perception of harm. So these are also two variables that I could use data to see. I could look at the legislation, and then I could look at attitudes from youth and adults around perceptions of harm. So what are we going to do about it? So we're going to do this activity. We're going to provide the Smarter Start program to all 3 of these school districts in Armstrong County. And then the outcome or the long-term impact that I hope is there, that I want to be there, is that is going to decrease the rate of use among high school youth in Armstrong County by 20% by 2025. So this is plausible and doable. So you want to provide this program to the 3 school districts in the community. It's also testable because we can measure the starting and end points of this. We can measure the marijuana use in high school youth. And then if your program can prevent the use in youth, we know that that's meaningful. And we know that's meaningful because as preventionists, we know that the earlier someone initiates substance use, the more likely it is to be problematic for them later in life. So this fits all 4 of those criteria, right? But not all theories of change are simple and straightforward like this. Sometimes they get way more complex. So I wanted to show you an example of that too. So let's look at this other one. This one actually comes from the Accountability Lab. The Accountability Lab is an agency that works with young people to develop new ideas in accountability and transparency in open government. But I feel like their agency model is actually it's not far off from prevention programming. So let's take a look. So They start with the assumptions that all communities and voices are equal, that individuals have the ability to change, institutions and systems, and then their team, but our lives have value, right? So they have their inputs, they have their relationships, the human capital, financial resources, and information. And we start with those preconditions that there's a need for accountability to exist, political and civic space to operate, communities have to be willing to participate, and partnerships to facilitate change. And so we know if we do these things and we work this way, then we hope that there's collaboration for campaigns, there's incubators and training and multi-stakeholder initiatives to make this policy change, which will result in coalition building, new knowledge and skills, communities for change, and active engaged citizens, which ultimately will make a more inclusive, accountable society. So like I said, sometimes they're not super straightforward. Sometimes they get a little complex because there's a lot of moving variables on that, right? Because life is messy. So if a theory of change is the narrative that explains how and why an intervention will cause the change, then the logic model is the graphic representation of that narrative. So this is an example of a program logic model, which we're probably all pretty familiar with. So you have your problem statement that youth use marijuana. And then you have your root causes. So why? Why do we think so? Well, they've got favorable attitudes and they've got availability, and I've got data to back that up. But why here? So what are the local conditions in the data? And they break down, well, pure use of marijuana and adult use, youth purchasing. So this is a program logic model. In evaluation, we use a slightly different model, but it's the same sort of concept. So let's take a look at that. So in evaluation, we look at logic models this way, and the CDC actually provides this example. So we're thinking about a logic model using the left to right processes and connecting the series with if-then statements. So if you have the certain resources you're needed to operate this program, you could start out with your resource inputs, and then if you have access to them, then you can actually use those to accomplish your planned activities. If you do your activities, then hopefully you can deliver the amount of service you intended. If you accomplish those activities with to the extent that you wanted them to accomplish, then your participants will benefit in a certain way. And if they benefit in a certain way, then that creates a larger group change. I always learn better by example, so let's go through a couple of examples here. So ask yourself how you can complete the following to describe your program. So if you had a resource, this resource and this resource, then you could do this and this, which would result in these two outputs. So for example, if we have access to the high school students and the Smarter Start educators, then we could implement the Smarter Start program and provide that education to parents and teachers and students. And then that would result in a 20% decrease in marijuana use among high school students in Armstrong County. This is another further example of a logic model that's broken out a little more, and this is probably more common of what you would see in an evaluation. You see a list of your inputs, so I see my district superintendents, the students themselves, the parents of the students, and those educators. I see my activities of what I'm actually going to do. I'm going to put flyers on campus. I'm going to do classroom presentations. I'm going to send letters home. I'm going to do a pre and post survey to find out what those attitudes and beliefs are for that certain set of kids and parents before and after I do this program. And then hopefully by the end of it, they're going to be better educated about the risks of marijuana use. So that is going to result in them making better choices and a 20% decrease in marijuana use among those high school students by 2025. And if those high school students can decrease use, then the overall use in Armstrong County is going to decrease. So see how this takes my theory of change and kind of breaks it down into the individual components and gives me a map for how I'm going to get there. This is where we wanted to break out into a group activity. So this is your chance We really wanted to make this meaningful to the folks attending the training today so that you could have a chance to figure out how to apply this on your own to your own programming. So some of you may already have programs in mind that you're thinking about evaluating or you want to go down this path with. So we would like, Kristen is going to break you out into groups here in just a moment. And I would like your group to take the next 10, 15 minutes. And then we're going to try to answer these 4 questions. We're going to try to come up with a simple theory of change, not one of those ones with all the complex, but one with maybe 4 boxes. So I assume or observe that. I think it's because, so if I do this thing, if I do these activities, then I'm going to hopefully have these results. Just a basis of a theory of change, just to start getting you thinking about how this would work for your own program.